Okay, we're going to talk now about the potassium channel blockers. We're going to talk about the class 3 antiarrhythmic agents. So let's talk about the case. A 56-year-old male with a known history of both atrial and ventricular arrhythmias presents to your cardiology clinic for a follow-up visit. He denies any palpitations or chest pain currently, and his EKG shows no acute changes, although his QT segment is prolonged. His medication regimen includes a drug that acts by blocking potassium channels in the cardiac myocyte. You explain to him that he appears to be doing well and that his cardiac arrhythmias appear to be controlled, but you caution him that his medication could predispose him to developing other cardiac arrhythmias, including torsades de pointes. Okay. So again, I'm just looking here at my Kindle. I'm looking at these Lang pharmacology cards, which are amazing. I recommend you try these. I'm just making these videos to help me understand them more. So the class 3 antiarrhythmic agents, they include sotalol, ibutilide, dofetilide, and bretylium. So bretylium seems to come up a lot in our classes at school. Mechanism of action binds to potassium channels and block the flow of potassium ions out of the cardiac myocyte. Not in, it blocks the flow of the potassium ions out of the cardiac myocyte. So by blocking potassium channels, phase 3 repolarization is prolonged, as is the entire duration of the action potential, thereby prolonging the refractory period of the myocyte and thus decreasing the contractile frequency of the cell. So sotalol has a potent beta-blocking activity, it says. The clinical use, its main thing here is for atrial arrhythmias. Atrial arrhythmias, class 3 antiarrhythmic agents, potassium channel blockers. Other, amiodarone is an antiarrhythmic agent that has class 1 through 4 antiarrhythmic actions. It has been shown to block sodium, potassium, and calcium channels on cardiac myocytes, and it has also been shown to have some alpha and beta adrenergic blocking effects. It primarily acts to prolong the action potential duration as well as the refractory period of the cardiac myocyte. It is used for the treatment of atrial and ventricular tachycardias. Side effects include pulmonary fibrosis, hepatotoxicity, thyroid dysfunction, cardiac arrhythmias, ataxia, and photosensitivity. We're talking now about amiodarone here. So think about amiodarone, think about bretylium, think about atrial arrhythmias. These are class 3 antiarrhythmic agents which are binding to potassium channels and blocking the flow of potassium ions out of the cardiac myocyte.